We're doing cleaning and a filling for her today. She had braces done before, I think back in high school. Yeah, so she has a retainer, and those are the things that will possibly challenge her oral hygiene.
Oral healthcare in Kenya has been below par. The country did its first ever oral health survey in 2015, and in it was a picture of a health aspect grossly neglected. In that year, oral health had been allocated 392,400 Kenya shillings in the national budget. The country has about 1,000 dentists for a population of over 45 million people, giving a dentist to population ratio of 1:45,000, far from the WHO recommended ratio of 1:7,000. Moreover, 80% of these dentists are based in the large urban centers, leaving large segments of the population based in the rural areas grossly underserved.
Children, as long as you have teeth in the mouth, the first two, the first one, come in. We are focused on oral hygiene. And oral hygiene is not just the tooth. There's the gums, there's the tongue, there's the cheeks in there, and oral hygiene among oral diseases, it's all in our specialty. So as long as you have a child who has a mouth, please bring them in, because it is our focus. We'll be able to show you how to clean those gum pads, so that you're exposing this child to milk, and you don't want that milk staying in the mouth for long, because again they will have the bad breath, and that's very common in newborns because they're having milk staying in there. We'll teach you good habits, and these days we are more and more aware about the contribution of breastfeeding with jaw development. So we're able to advise you even more to do with that, because breastfeeding is really good for jaw development and proper swallowing habits. So we find that if your child is exposed to breastfeeding for at least 2 years, then you find jaw development is much more superior to someone who doesn't breastfeed for long. Bottle feeding is not good for your child, particularly prolonged bottle feeding. It's not natural. The swallowing will be messed up with, and the longer they bottle feed, the worse it is for their development. And then you find things to do with now early childhood decay, caries or tooth decay. It happens particularly for kids who are exposed to medication and syrups at an early stage. So there are so many things we can do with children that people don't bring them to the dentist because they think this is a milk tooth, it will just go. But ideally, we can manage most of these things, and we catch early misalignment of teeth. And the earliest we can treat a misaligned tooth or jaws or basically poor oral habits, the earliest we can intervene, the better it is for them with their growth. And you will find that you can easily reverse the bad effects that are now seen with poor oral habits at that early stage, and then it will not manifest later. And then you will find the need for braces will be reduced, or it will be very short term when they need it or the time comes. So you might feel as if a bit of a discomfort in your gums. You might also get like a feeling of a bit of poking a bit. Yeah, but that's about it. Okay. Yeah, right? So the sensitivity goes away. It's very transient.
In a year, more than 50% of children will experience a toothache or discomfort. Oral health problems affect children's quality of life, where they are unable to chew hard food, some avoid smiling due to their teeth, and some miss school due to a tooth-related problem.
There's the painful ones, and those will entail the most superficial being the cavities, followed by dead teeth that have suffered extensive cavitation destruction, that you end up now getting the sleepless nights, getting those swollen jaws, and that's just basically an extensive cavity. Then you need a root canal, and then after that you might see the other common one that is painful is gum disease. When gum disease is really severe, then you find that the gums are really swollen, that they're really bleeding. That's also very common.
Despite all this, 50% of children have never visited a dentist, and those that have gone to see a dentist will do so because of pain and discomfort. Among adults, 40% have never visited a dentist. Dental decay occurs in 2 out of every 10 children aged 5, 12, and 15 years. The children aged 5 years, however, have a high prevalence of dental decay, occurring in almost half of them.
You okay? The painless ones would now have to do with discoloration, that is to do with fluorosis that we see commonly in particular areas of this country. And now with the uptake of borehole water that has increased over time, Nairobi is getting more and more incidences of fluorosis. So now fluoride in the water is on the rise because people are taking more and more borehole water. Then the other painless one would possibly be again gum disease, because sometimes it doesn't present with pain. You just come, someone telling you that there's a loose tooth or loose teeth.
In children, bleeding from the gums occurs in about 3 out of 4 of them. But this is worse in 5-year-olds, where almost all the children report bleeding gums.
Gum disease is just because of poor oral hygiene, majorly poor oral hygiene. There are a few incidences whereby it is associated with medical issues, and but that is on the rare side. The most common, as you've asked, is just poor oral hygiene. And then you find it is neglected over the years. And then you find with that comes gum disease that follows with sometimes even tooth extraction. And I've said if you have diabetes coupled with your gum disease, sometimes you end up having all your 32 teeth going away, being extracted in under a year, just because you ignored it.
This may explain why 0.3% of the Kenyan adult population have no natural teeth.
For the adults, the things that will lead you to the dentist is pain. Don't wait for that pain to keep you up at night. Come in as soon as you can pick up anything and make it a routine visit. Your dental visits are going to be cheaper than regular visits you have to your dentist. So I'm just basically checking on the tooth that I'm going to be working on. That will require the filling. The metallic fillings used to have an alloy of metal. That was basically one of the things that there's a debate about it. Mercury being one of them, tin, silver, copper, and they had certain components in them that help fight tooth decay. Particularly, that makes them beneficial in terms of working with the old patients or the very young kids, because they don't really have that same properties as the teeth, whereby they don't expand and contract the same way a tooth would. And that's why they're being phased out slowly, but not because of the mercury, no. The mercury content was very minimal. You'd have the hard outer surface, the softer but still hard inner surface. Now the softer but still hard inner surface has innervation. Now that is what picks up the sensitivity, and that, as you correctly said, to sugary and extremes of temperature. So you'd find that once that hard but slightly softer inner surface of the tooth is exposed in the mouth, through either decay or any other cause, maybe the tooth chipped off, or sometimes you find gum disease, then your softer part of the tooth is also exposed, then you'd get that sensitivity. So it's just a matter of identifying the cause, and then after that is done, we can manage you accordingly. Get first a soft toothbrush. They are now coming into the market. Not medium, not hard. Soft is good, because you don't want to injure your soft tissues, that being the gum and the tongue and the cheek. And then once you have a soft Bristol toothbrush, you need to angulate the brushes 45 degrees against the tooth surface, and then it should at least penetrate the gum a bit, and then massage that area, not circular, but just back and forth, without moving those long strokes. So you focus on about 2 or 3 teeth at a time, and you go all around 2 to 3 teeth at a time, up and down, and just get those teeth out. Then after that, please floss your teeth afterwards. Don't just brush and then call it a day. Floss it after you've done your brushing. If you can do flossing 2-3 times a day, even better. And then nowadays in the market, we have what we call a water flosser. For people who don't like that string piece of floss going in between your teeth, because sometimes they'll press against the gum, get a water flosser. The danger with toothpick is gum injury. Most people are not able to have the good control of picking the teeth, and that is where now you'll find people coming, sometimes the piece of the toothpick stuck in between that we have to retrieve for them, because you're not able to see in between your teeth very well. It will just be tactile. It will purely be tactile, whereby you're pushing something in between and you're not able to see it. So with such incidences, you need to be as safe as possible, whereby you're able to put it in and able to remove it without the help of a third party. And that is where we advocate for flossing, because it's a piece of string. It doesn't easily snap, or if it does, it is easily removable without necessarily getting help from a third party. And you can take it in and out of your teeth spaces with ease. And nowadays there are so many that have even a handle that you can put in your bag or wallet and walk around with it and floss in between your teeth, as opposed to pushing in a toothpick. And it is rather decent to use a floss because it will actually get more out than the toothpick will. And if the gaps between the teeth are much bigger than the floss, there is now what we call interdental brushes. And that is why I push for water flossing, because water flossing doesn't segregate depending on the size of the interdental space. Well, that is the space between the two teeth. So the wider the space, the water flosser will get in. If it's narrow, the water flosser will still work very well. But with a floss, if it's wide, then you need a brush that goes in between. The practical advice would be that after every meal, please take some water. Help with the self-cleansing of the mouth. And then there are nowadays what we have in the stores or in the supermarkets, that is sugar-free gum and sugar-free lozenges that you can suckle upon to encourage saliva production, and will help with the self-cleansing of the mouth. And the sugar substitute that they use is actually good to take care of the bacteria that attack your gums. So that can really help with that, provided you have the etiquette of chewing. Don't chew so loudly that you annoy your office colleagues. Yeah, if you can carry those little tiny flossing handheld flossers, if you can do it quickly in the bathroom just after a meal or somewhere in private, and then get the food that is stuck in between your teeth out, even better. And then avoid sticky foods, because those are things people do with their desserts after a meal. Avoid the sticky foods as much as possible. People snack a lot. We are in an economy that is moving fast. People don't sit down enough to have enough lunch, breakfast or supper, so they end up taking snacks in between the day. And then offices are also culturing that more by having a coffee dispenser that is just stuck there, and people can take as much coffee or tea as they want. Then they put either milk and tons of sugar in there, and then they're constantly bathing their teeth with sugar. Others even have sweet dispensers that now people are tossing in. Every time in a bus there's someone who's walking around holding a packet of tropicals and Orbit and selling to people, and that is sugar that people are just consuming continuously. When people are bored in the office, they take that up as a habit as well. They'll buy cakes, they'll have something in the drawer that they come home with. So that is there a lot. Most people hate brushing their teeth at night because I don't know why. Some say it tastes of the toothpaste, some say it's laziness, some say they've never done. So they do it only in the morning. And in the morning, it's actually a social affair. You basically just want a fresh breath or a fresh feeling in your mouth before you go out. At night is more important because saliva production goes down. So you need as much fluoride soaked in your mouth as possible to prevent tooth decay. But most people do not do it at night. They'll do it in the morning because they feel, now I'm going to meet people, I need to have fresh breath. Don't do that. Do it at night, do it in the morning as well, so that you're able to enhance that oral hygiene as much as possible. People don't floss. In fact, flossing is the biggest challenge most people have world over. It's not even a Kenyan thing anymore. It's just world over. People just don't floss, or they choose to not floss. So those are the bad practices that I see around. I mean, chewing of miraa would contribute because that's a lot of, you sustain that green stuff in your mouth, the miraa, the cut that you're chewing, it stays in the mouth for much longer. So a lot of staining comes from that. I mean, it's good for your jaws and teeth because you're constantly chewing, so you have the exercise. But the downside of it is that now you're just bathing those teeth with that green stuff, and it's really staining in the mouth. So that's really one of those things that you'll see. When they come for cleaning, they're really dirty. Yeah, so those are the things that you tend to see with this miraa chewers. The other substance abuses that we tend to see is now with the hard drug users. Hard drug users tend to have poor oral hygiene. It's almost a standard. In fact, if you're dealing with drug addicts, you possibly are also dealing with really bad oral hygiene. Yeah, but that is in particular setups where they're able to come and access the dental treatment. Most of them don't. In fact, if you look at a drug addict or if you're in a drug rehabilitation center, you'll possibly have tooth loss that is on the higher side, majorly due to decay, and then secondarily followed by gum disease. But it's majorly decay. And some of those drug abuses that are taken orally tend to have really adverse effects on teeth. Right? Those are things to do with amphetamines and things that people are taking out there that are really bad for oral hygiene. So the substance abuse is there, but I wouldn't say it is the higher number that we deal with. You'll have to be in a rehab center as a dentist or near a rehab center as a dentist. Yeah, then you'll be exposed to the substance abusers. Out here, it's majorly to do with mirror chewers and snacks. Yeah. But remember, when you're doing this kind of fillings, you only are supposed to touch the tooth that you're working on and not the one next to it. So there are certain protective, so that we don't have a tooth losing its vitality. Diabetes is the most common one, where you have diabetics have low immunity to begin with, and you have gum that is really highly perfused with blood. So because there are very many blood vessels that come to the gum, so the ends, they're very tiny ones, but so the immune system is not that good at the gum level. So you find that food accumulation, any little food accumulation there will cause gum disease. So particularly with poorly controlled diabetes, you will now find things like pus coming from the gums, and it's very advanced gum disease in those cases. Poorly controlled diabetics we are able to pick up poorly controlled diabetics easily on the dental chair because of the kind of extent of gum disease that they will be showing vis-a-vis someone who doesn't have diabetes. So you'd find that the two comparatively will have one which is way worse off, but the load of, say, dirt in the mouth would be the same. But with a diabetic who is poorly controlled, they'll be showing advanced gum disease as opposed to one who has no diabetes or controlled diabetes. So that is the easiest indication of poor controlled diabetics, or those people who do not even know that they are diabetic to begin with. So you'd find out for them, or you tell them they're on the spot. We do regular diabetic checks here, particularly if we see those signs and someone says they're not diabetic. So we'll check for them, and then now we'll either ascertain, or if we catch it, then we tell them to start seeing a clinician to help them with the diabetes that they're suffering. Epileptics, they're taking particular medicines that are calcium channel blockers. That also contributes to gum disease as well. So there are certain medications that they're taking that help, or rather assist that gum disease spread even more. Then the hypertensives, they're also taking some medication that help gum disease spread even faster. Now there are incidences with pregnancy that also happen. So you find that in pregnancy, the hormones are on the high. There's a lot of hormonal imbalance that goes on in pregnancy. That also enhances gum disease. So you'd find that even the smallest speck of dirt that is in there would cause gum disease that is, not tantamount to whatever it is that they're suffering. So we advise that if you're pregnant, come for a clean and sustain that throughout pregnancy. I mean, the cleaning doesn't affect the pregnancy in any way. It's not invasive. We're basically using ultrasonic, and you're going for ultrasound, so it's more or less the same thing. We're not having anything that would interfere with the pregnancy in any way. All right. So some mothers say that they lose teeth every time they're having a pregnancy. So sometimes that is associated with gum disease, mostly due to decay that was unmanaged from before, and they're not able to follow up with the decay management during the period of pregnancy because they can't be exposed to radiation due to the child that is being formed. So we advise the ladies who are getting their pregnancy tests done at an early stage to come in. We do the cleaning and sustain the cleaning throughout the period of pregnancy. Should they have decay that can be managed, we will do that temporarily until the stage when they're ready to maybe be exposed to some radiation. But we can manage that for them. Yeah.
So there are people who probably had the old school filling that had heavy metals.
Yes.
Is it possible to remove that filling and replace with this newer filling that is almost looks like the tooth?
Yeah, it is very possible. It's possible. Is it necessary? That's another question. Yeah, but it is possible. Mm-hmm. Yeah.
So what would you do? if somebody comes and they want their filling replaced, what happens?
What we do is exactly the same as we do it today. So we will just treat it like we're filling a new cavity, whereby now we will remove the old filling and then clean the tooth in case there's any decay that has started underneath. And then if there is no decay, we basically just get rid of the old filling and then make sure the cavity is clean, because this newer filling requires a very clean surface to work with. Then after that, we just fill and you're able to use the tooth immediately after. Yeah, so it is very possible. The same process as we saw today. So basically remove the old filling, condition the tooth, bond the tooth, apply the filling, check your bite, polish it, and you're good to go. One of the things that you look out for in teeth that require fillings are dark discolorations that you will see on this tooth, like in this groove right here and that one there. Those are normally indications that early stages of cavity formation has happened or is ongoing as we speak. So even that whole area there is dark, compared to, say, for example, this tooth here that doesn't have any dark discoloration on it. Then you confirm that on x-ray so that you can just note the extent of tooth decay that is ongoing underneath that dark discoloration. In referral hospitals, the big referral hospitals, they tend to have very good dental care, but the lower the level of the hospital, the less and less services available to you as the public. So you find that now the government support with dental health is not good. You would find they don't really restock whatever materials that we need. They don't supply or maintain the equipment that we need. Maintaining a dental chair and a functioning dental chair throughout the life of the dental chair is expensive, and it's not an expense the government is willing to visit. And you'd find now that we reduce those public sectors or those public dental clinics to extraction centers. So you find you're coming in with a cavity that a tooth can be saved, you will pull it out because the next center is so many kilometers away and you don't have the money to get there. So you find that now diminishes the number of services that would be available to such kind of public sectors. In fact, there are centers where we have worked before ourselves, myself included, whereby I have had to pull out a tooth, not because it was necessary. So you find that the number of teeth I'm pulling out here has significantly reduced compared to the number of teeth that are being pulled out in the public sector. Yeah, so it's definitely a problem we have. Yeah, people are losing teeth unnecessarily. Yes, so that you get. The public sector is definitely much more subsidized because the government has played a part in the cost management of it, because they've acquired the equipment for it and we have recommended pricing for that. But now here you'd definitely be about 2 to 3 times more compared to the public sector. So the cost would range from, in the private sector, starts from as low as 3,000 shillings to as high as 10,000 shillings. Some even go to as high as 20,000 shillings. In the the public sector, you'd have that going as low as 500 shillings, 1,000 shillings, 15, or maximum of maybe 5, maximum of maybe 5,000 shillings. Yeah.
This is per procedure or per tooth?
Per tooth. Teeth have surfaces, and is more than one. So we talk from a simple cavity, which is only involving one surface, to a complex cavity that can involve 3 to 4 surfaces. So the higher the number of surfaces involved in the cavitation, then the higher the cost implication of that particular surface. Then the next thing is the material that you use. If we use the tooth-colored filling material that we do use today, those are pricier compared to those ones that you mentioned earlier, where we have the metallic fillings. So those ones are cheaper and they're quicker to fix. They're less technique sensitive, takes much less of my time. Those ones I can do for every 1 tooth-colored filling, I will probably do 2 or 3 non-tooth colored filling. That includes those metallic ones. So you find they're more technique sensitive. So they take up more time and they're more costly as a result. 2 surfaces between the 2 teeth are still as tight as they were before. You do that with the floss and you make sure it's smooth. And you can see for her, surfaces are still as tight as they were. Cost is a big barrier. It's a huge barrier. Cost is a big barrier, for sure. And you'd find even as much as people are covered with insurance, very few insurances have ideal dental covers. In fact, medical cover is much better. You'd find someone is covered medically to the tune of millions, and then dental care is possibly 30,000 shillings only. And sometimes even that 30,000 shillings is not sufficient to cater to the dental needs of that particular patient. And not every dentist would be on the panel of a dental insured patient, and then they would need to maybe look around and see who is there. So cost is a big barrier to dental health in this country and everywhere. Cost of living is going up. We're taxing everything. Dental materials are expensive. It's a very specialized field. So I don't see it going down, because the equipment by itself is very specialized, and it's just getting more and more specialized over time. I see an incident whereby we possibly will maintain the cost of the procedure. They will not significantly go up as technology improves, because technology is making our lives much, much easier. But that will not necessarily take the cost down. It will just prevent it from spiking as fast as, say, your fuel prices. Yeah. But now the taxation is coming in and all these things that, because you see, medicine is now put under the VAT. Dental care has been suffering these VAT charges from even before. So you see our materials are VAT charged. So we find we will always be a price point higher than the medical care. And now the medical guys are joining us in the same thing. And then you see also the numbers that we're able to service per time. We cannot have a queue of 100 and then one dentist is servicing the queue of 100 a day. The most you will do is probably 10 if you're really doing good dentistry. Maximum maybe 14 or 20 per person in a day. And in a day I'm talking about you've worked continuously from morning to evening. That's about 8 or so hours, and you're doing your procedures right. Yeah. Then you'll find that now cost, I don't think cost will go down, no. Yeah, it will really take the government subsidizing it a lot. And now just take care of your teeth. Teeth are meant to last a lifetime. Don't lose your teeth for whatever reason. Frequent visits help keep your costs down. So that's actually one way of keeping your costs down. See your dentist regularly. Yeah, your cost will be sustained to just cleaning and maybe 1 or 2 cavity fillings. So that will always keep your costs down. The longer you stay away from us, the more expensive your care will become.
Oral health is not just about your teeth, your gums, your cheeks, your tongue. Basically everything in your mouth needs attention, and anything you put in your mouth determines how soon and how frequent you'll need to see a dentist, which you should. This has been Health Digest on Oral Health. I'm Dr. Mercy Korir.
KTN News. Get the whole story.
We cannot have a situation where we forget to see humanity.